Moving on to the second important topic for today, we will be discussing prevention of thrombosis. And as you can imagine, that patients with myeloma at the time of their diagnosis are at highest risk of developing blood clots in their legs and the lungs. The primary reason behind that is the amount of inflammation we see in newly diagnosed myeloma patients, along with use of steroids as well as lenalidomide for chemotherapy treatment. Moreover, patients who have bone pain and bone fractures are also at risk of developing blood clots. Certain other traditional risk factors that can actually provoke blood clots include advancing age, obesity, patients who have prior known thrombosis, patients who have had bone fracture, trauma, surgery, or who had a catheter like a port placed in their body recently. The way we address thrombosis and its risk and prevention in myeloma patients is by stratifying these patients. If you happen to be a patient who has known history of arrhythmias, or for that matter, prior clot in the legs or lungs, you should continue anticoagulation at full dose while you're on treatment for multiple myeloma. Having said that, if you don't have these risk factors and you don't have any other additional risk factors that I already highlighted, you can give a baby aspirin, which will be adequate as prevention for thrombosis. Having said that, if you have any of the traditional risk factors that we just discussed in the previous slide, you should either be on full dose aspirin or, for that matter, Xarelto as a blood thinner while you're on chemotherapy for multiple myeloma.